going to review a somewhat typical case that I would see in gynecology clinic to point out some of the important concepts about how different systems of our bodies work together, as well as important things to be thinking about during perimenopause and menopause transition. So this patient came in, she was 43 years old. She'd had a Mirena in since her last child that was placed and then replaced, so ongoing treatment with that for about 10 years. From this, she had no menstrual cycle, so that was not a trigger for her to be thinking about menopause or other hormone changes in her body. She had been reporting, but had not gotten any evaluation for symptoms of brain fog for a couple of years, lower sex drive, worsening sleep, mood swings, hair loss, breakouts, increasing fatigue, and more recently worsening hot flashes and night sweats. She felt sort of dismissed with those symptoms. She'd also been having a lot more painful bloating and had noticed certain food triggers from her own research, onions and garlic, and had eliminated those and helped a little bit. She also had been on a proton pump inhibitor for a long time for symptoms of reflux without any kind of plan to wean or try other things, and hadn't had any kind of repeat GI evaluation from being on that. After I talked with her, I gave her a full low FODMAP nutrition plan to follow to see if she did possibly have SIBO, which proton pump inhibitors can be amazing and completely necessary to stay on for certain conditions, but long-term use for other people can have some consequences, can increase the risk for small intestinal bacterial overgrowth, as well as some malabsorption of certain nutrients. So we tried a full low FODMAP diet just to see if that would further decrease her bloating, to help her know what kind of GI evaluation to look for. I gave her additionally a plan to wean the proton pump inhibitors to see how that would impact her symptoms. Instructions to follow up with GI to look into possible SIBO testing, maybe H. pylori, maybe repeat endoscopy, to know what she really needed to pursue from a GI perspective. Also ordered some labs, which on follow-up did indicate probably full menopause, but hard to tell because she didn't know what's been going on with her cycle, but probably the FSH was pretty high, probably full menopause, as well as the timing of the symptoms, but we'll repeat that again to be sure, because she's relatively young, what to expect with her hormones moving forward over the next few years. Check some nutrient levels, low normal Bs, some minerals on the borderline, as well as omega fatty acids, low, which can increase inflammation and not be ideal for health. Also had checked thyroid due to some of the symptoms she was having, the hair loss and fatigue. Androgens, again, hair loss and breakouts, sometimes those can be problematic, and basic chemistries, which were all okay. On her, so after this, I did start her on some transdermal estrogen, kind of a medium dose. We left the IUD because we're still going to follow that menopause hormones to see if they're staying high or if it's fluctuating before we pull that IUD out. I did do a short trial of oral progesterone just to see if she felt good with it. Occasionally people will feel bad, and a Mirena IUD can still be useful in menopause for some people. However, ideally it is good to remove the progestin if possible when we're having symptoms of hair loss and breakouts, because for some people over time, and especially through perimenopause and leading into it, hormone changes can get some more symptomatic androgen-like side effects from a Mirena IUD. Not everyone, but some people do get that. She did feel well with it, but didn't stay on it until we're deciding what to do with the IUD. Also discussed nutrient repletion for the things that were low, and the importance of figuring out what is going on from a stomach and a SIBO perspective, possibly, to better understand how to manage her nutrition and health of her intestines and absorption. So that is still a work in progress, but very, very important. And also discuss transitioning hormone doses over time. Nutrition is always incredibly important, you know, especially for young people on the younger side for menopause. Using some hormone repletion can be very preventative in a lot of ways, from a cardiovascular, dementia, and bone loss risk reduction. We don't have to wait for years and years. These things can be started in low doses and transitioned over time as perimenopause and menopause continue to evolve. So she's certainly still a work in progress, you know, still needing to work with GI and know what to ask for and what to look for, but she's already feeling a ton better as far as brain fog, sex drive, her sleep, mood swings, fatigue, hot flashes, and night sweats, with some, you know, moderately dosed transdermal estradiol and nutritional changes that she will need to continue to work with.